The purpose of Ascend-I is to see whether taking aspirin and omega-3 fish oils has any effect on a number of different eye conditions. Having diabetes can sometimes be associated with a number of different eye problems and can affect people's ability to see. Amongst the most common and most serious of these complications is a condition known as diabetic retinopathy, which is a problem affecting the delicate network of blood vessels in the back part of the eye known as the retina. In severe disease, abnormal growth of some of these blood vessels can sometimes result in bleeding and scarring on the retina. Now, fortunately, diabetic retinopathy is preventable and treatable caught at an early stage. And for that reason, every person with diabetes in the UK is invited to attend an annual diabetic eye screening appointment. Studies from the 1960s first suggested that tiny blood clots blocking the small blood vessels in the retina could initiate the chain of events that results in people developing diabetic retinopathy. Because doctors know that taking aspirin can sometimes prevent the risk of blood clots elsewhere in the body, they also thought that they might be protective in diabetic retinopathy. But there were also concerns that it might increase the risk of bleeding. Now, two small but well-conducted studies have sought to investigate this further, but they've produced conflicting findings. Because Ascend is much larger, we have a really important and exciting opportunity to see whether aspirin might protect against diabetic retinopathy. As people get older, they often notice that their eyesight can deteriorate. And for the majority of people, this is caused by a weakening of the muscles in the eye, which help us to focus our attention on an object of interest. And this is why a lot of older people often end up wearing reading glasses. For a smaller proportion of people, they can have more profound problems with their eyes caused by a condition known as macular degeneration. And this is a condition which causes damage to an area of the eye which is responsible for our central vision and seeing things in fine detail and also colour. Now, having diabetes doesn't actually increase your risk of having macular degeneration, but studies have suggested that taking aspirin and fish oils could play a role. And this is why we've got a really good opportunity to explore this further as part of the Ascend-I study. We're going to be sending out our participants a questionnaire through the post that's going to ask you about any problems with your eyesight and also any problems that your eyes might cause you doing day-to-day activities like reading or driving. We hope that this questionnaire is only going to take about 20 minutes to complete. If you have any questions about it, then please do get in touch with the coordinating centre using our free phone number, and we'd be happy to help with any questions you might have. Thank you.